Hi, it's Dr. BCW. As we close up National Diabetes Month, I want to answer as many questions as I possibly can. So I'm going to try something new and do a lightning round style video and share short, concise answers in hopes of answering as many questions as possible. So let's jump right in. How do you diagnose diabetes? Type 2 diabetes is diagnosed through a blood test such as a fasting blood lab test or hemoglobin A1C test. This will show how much sugar or glucose is in your blood at that time or in the past 3 months. What increases the risk of diabetes? Risk factors can vary, but can include family history, weight, activity level, and age. What's the link between obesity and diabetes? Excess weight can increase the risk of developing diabetes. However, not everyone who's considered overweight has diabetes, and not all diabetics are overweight. However, extra weight can increase your risk of developing it, especially if other predispositions are present. Can diet affect diabetes management? Yes, what you eat can impact your blood sugar levels. We often hear about the Mediterranean diet as the go-to diet for improved blood sugar control. However, this diet has been studied more extensively than other cultural and ethnic foods, so it's not definitively the best. Since many diets have not been studied for blood sugar impacts, there are unknowns. Mediterranean diet should not be the only type of diet highlighted when managing diabetes. However, it is often used as a reference. I encourage you to eat the diets that are culturally and ethnically inclusive to you while trying to maintain a healthy balance. What should people with diabetes eat? Focus on foods that contain a balance of protein, low sugar or natural sugar, and vegetables, and a balanced amount of carbohydrates. Can exercise manage diabetes? Absolutely. It improves insulin sensitivity and can lower blood sugar levels. Exercise is a great tool in the battle against diabetes. Does diabetes cause skin issues? Diabetes can be associated with several symptoms and complications such as heart disease, stroke, nerve, and eye damage, and increase the risk of developing dry, itchy skin and infections. There is also evidence that poor circulation caused by diabetes can also cause hair loss or hair thinning. How do you treat type 2 diabetes? Through blood sugar monitoring, lifestyle changes, including diet and increased exercise, and sometimes medications are needed. How can loved ones support someone with diabetes? By learning about diabetes and asking how they would like to be supported in managing their diabetes. We are all different and no support model fits everyone. Why is insulin key for diabetics? To get glucose or blood sugar into your cells, you have to have insulin. Insulin is a hormone made by the pancreas located just below the ribs. Insulin is like a key to the door glucose needs to get through. Your cells use insulin to unlock that door. That lets glucose or sugar travel from the bloodstream into your cells. Can diet prevent diabetes? A healthy lifestyle may help prevent type 2 diabetes, but there are some cases where diet and exercise have no impact at all. Type 1 diabetes, for instance, is not associated with diet and exercise and is defined as an autoimmune disease. Is diabetes linked to other autoimmune diseases? Yes, type 1 diabetics often have other autoimmune disorders. Does stress affect diabetes management? Stress can increase blood sugar levels and make managing diabetes harder. How often should people with diabetes see their doctor? This is based on how well your diabetes is managed and if you have developed any complications associated with the disease. Not everyone is the same, and how often you need to see your doctor can vary based on your health. How do you monitor blood sugar? A finger stick is a quick and easy way to check your blood sugar at the moment. A hemoglobin A1C provides a snapshot of your blood sugars for the past 3 months. It's a simple screening test that can be done in a clinic by your healthcare provider in just a few minutes. A CGM, also known as a continuous glucose monitor, can provide insights into how your body responds to food and activity. It's easy to wear and won't interfere with your daily activities. And you can be informed about your blood sugar levels for multiple days. Can diabetes be reversed? With proper medical treatment, diet, exercise, and lifestyle, diabetes can be well managed and symptoms can be minimized or in some cases negated. However, diabetes is a chronic condition and currently cannot be cured. What are the biggest areas we need to improve in providing access to diabetes care? It starts with improving access to diabetes care in a multifaceted approach, starting with creating health literacy that highlights the stories of patients living with diabetes, diversity within healthcare teams to reflect the communities they serve, and creating a healthcare model for diabetes care that embraces individualized care, inclusive of different cultures and ethnicities. Are there new diabetes treatments? Yes, there are new drugs on the market, and the availability of CGMs is a relatively recent development. Still, with ongoing research leading to new medications, treatments, and technology all the time, it's hard to imagine where the future will take us. Remember, diabetes management is personal and ongoing. Always consult your healthcare provider for tailored advice. Thank you for joining me on this Diabetes Lightning Round. This is Dr. BCW. Thank you for watching Beyond Clinical Walls. Don't forget to subscribe and turn on notifications so you don't miss my next upload. If you found this information helpful, please hit the thumbs up and leave a comment. It really helps the channel. Thank you for watching and thank you for your support.